Good afternoon. I'm pleased to be here on behalf of the Joint Task Force. Let me make a few announcements and then we'll get to today's daily data. First, a word on the micro grant program to support close contact businesses. As was previously announced by Commissioner Lowry, we have been working with Commissioner Lowry and the County Commission to set aside, Shelby County government that is, to set aside about $1 million to support those close contact businesses that have heightened precautions that they have to take because of the mandates during this global health pandemic to help them and support them as they go about making their businesses safer and acquiring more protective personal equipment. That $1 million is broken out to about $2,000 in micro grant per close contact businesses. And so these include businesses like your hair care, personal care businesses, your barber shops and your salons, and so forth. Those businesses are really in need, and we've seen substantial demand for these micro grants over the last several days. And so we want to make sure that we get more information out about how to apply for these micro grants. And as you can see on the screen, we've called the program Our Beautiful Comeback because the program is so closely tied to the beauty industry. We'll be hosting a webinar or a grant walkthrough online for salon owners, barbershop owners, and owners of other close contact businesses to advise them about how to get through the application process. We will be hosting that grant walkthrough on August 31st, 2020 at 3 p.m. Keeping in mind that a lot of barbershops and salons are closed on Mondays, and so we tried to pick a time when we could get and interact with the most folks in that industry. So that again will be on Monday, August 31st at 3 o'clock p.m. And you can go to COVID-19 shelbycountytn.gov in order to register and make sure that you are online at the right time and at the right place so you can receive that important information. If you are a previous applicant to that program, you will receive notice by email of that walkthrough process. So we want to make sure we get the information out. We want to make sure that we continue to support businesses as they establish new protocols for safe and careful operation. The Beautiful Comeback program, of course, is just one piece of the puzzle. We will do more to help support these businesses and a safe and cautious recovery. A word on schools. With the return of schools in the last couple of weeks, the Joint Task Force has been working very aggressively to expand the lines of communication between the public health work and the school reopening work. The Shelby County Health Department in particular is working to expand the information that it provides to those at risk and to the public on pediatric cases. In fact, this week you saw an announcement from the Shelby County Health Department about how we will go about expanding that information on pediatric cases. The first priority, of course, is to make sure that those at risk of contracting COVID-19 are receiving information as rapidly as possible. And that includes everyone at risk. And so that means students at risk, family members at risk, staff at risk, and families at risk. We want to make sure that everyone who is at risk of contracting COVID-19 receives information as fast as possible. And this kind of information should be shared and will be shared even if there is only a single case of potential exposure or exposure. The notice, we've set a goal for that notice to be made within hours, and so that's what's reflected in the latest health directive from this week. And we have set a goal of providing regular follow-up notices to the at-risk community if there is a risk of exposure. In addition, there'll be regular releases to the public in general about pediatric cases. The reality is because school-specific information can ultimately be used to identify students, the information about children has to be handled with extreme care. We know that schools are places where information is spread quickly in the hallway, and because of the stigma that's associated with disease, this kind of information about children will have to be, again, handled with extreme care. Nevertheless, we'll expand the information set that's available to the public around pediatric cases. Regular reports will go out to show the number of cases by school district or municipal area. School districts are basically coterminous with the various municipal areas, and the process of building out that information set has already begun. So with that, I will welcome to the podium our Director of Health, Alisa Haushalter. Thanks.
Thank you, Mayor Harris, and good afternoon, everyone. I'll give brief updates, mention a few other things about the updated Health Directive number 11, then we'll open it up for questions. We are continuing to go in a positive direction. As of this morning, we have 26,528 cases. That's an increase of 122 from yesterday. I do want to note, though, from Sunday to Monday, we had an increase of 289, and that was more of an increase than we've seen in some days, and so we'll be watching that very, very closely. Our reproductive rate remains below 1. However, it has crept up a little bit to 0.89, so we'll also be watching that closely. We want to keep it below 1, but we also want it to continue to decrease over time and not start creeping back up, particularly as people get fatigued of all of the restrictions related to COVID. And then we've been able to extend our duplication time to about 45 days, which is a significant improvement and really much better than it was even at the very beginning when we had just a few cases. At the current time, unfortunately, we've had 366 deaths. That's 1.4%. Again, that's much lower than the rest of the United States, but any death is more than we would want in our particular community. The median age currently for death is 73, but the majority of cases continue to be in individuals that are younger than age 45, and unfortunately this week we are reporting a death in a child at the age of 13, and we do know that COVID was either the direct cause or contributing cause to that child's death. At the current time, we've recovered almost 87% of our cases, so that's 22,000, almost 23,000 individuals that 21 days later have improved. What I do want to note is that this is data that is going to change over time. As we've learned more about COVID, we recognize the recovery period may be much more extensive than 21 days, so do anticipate in the upcoming weeks that we may report differently on recovery, or we may discontinue reporting on recovery, and that'll be based on national standards and state standards. I want to highlight the fact that we continue to do quite well in Shelby County on testing, and as of today, we've tested 246,493 specimens. Now, some of those may be duplicated specimens, but that's a very small number. And our positivity rate for the pandemic is 10.8%. Again, we want that below 10% and ultimately at 5% or lower than 5%. But our overall positivity rate compared week to week has continued to decline over the recent weeks, which is very positive, and we're currently at about 11.5% positivity rate. And then lastly, I want to give some updates on testing. We'll probably have Jenny back in the near future to talk about expanded testing. But we are all working closely together, the city, the county, as well as our safety net providers to expand testing. Walgreens has opened a new site, and that's at Shelby Drive and Ross Road. So that'll allow individuals to have ease of access at that facility. My understanding of that facility won't have rapid tests, but it's still a drive-through site, so it'll be convenient. Then also the safety net team will be opening up a drive-through site at the Appling Emissions Center. So the old emissions center on Appling will be utilized, and then we anticipate opening up a third hardwall site in partnership with Christ Community in the upcoming weeks. Additionally, with the additional staff within the health department will be able to expand its testing as well. So ultimately, we will have availability of well over 10,000 tests per week in Shelby County. And so that's exciting news for us, and we'll continue to work on expansion and continue to work on use of new modalities as they become available. As far as our hospital capacity, hospitals are doing quite well. We have decreased emergency room visits for flu-like or COVID-like signs and symptoms, and we still are in green status within the facilities, so no challenges within the healthcare systems currently. In regards to contact tracing, because the turnaround time on test results has really decreased significantly, and most results are returned within 1 to 3 days, the health department is able then to start investigations very, very quickly. And currently we have over 10,000 people actively under quarantine. As we move forward in the pandemic, more and more focus will be on early identification of cases and then early identification of contacts and getting them quarantined in a timely manner, and then keeping those individuals within quarantine. The other thing I want to comment on quarantine, that's really a primary responsibility of the health department, but we rely heavily on our partners both in the school system and also within work settings to help identify very early those people who may have been exposed so that we can help get them quarantined quickly. So we appreciate everyone's efforts to identify contacts and get them quarantined early. Then lastly, I just want to give a few other updates on the health directive and just talk to some of the more substantive changes. Mayor Harris addressed very nicely the changes within schools, particularly in regards to communication. Our goal is ultimately to get information to people who need it to take action, and we'll work closely with the schools, just as we have with nursing homes, to get information out to anyone who is at risk of contracting COVID, and to try to do that in as quickly a manner as possible, and ideally within 12 hours. But the other things that we changed on the health directive is we wanted to clarify that limited service restaurants also includes beer pubs and wine bars. So beer pubs and wine bars are also expected to be closed currently. I think there was some individuals who may have thought because they weren't explicitly stated in the health directive it didn't apply. But any facility that sells more alcohol than food is perceived to be a bar in our state and therefore must be closed. I do want to note something, it's not in the health directive. We do know that the state licensure is working closely with restaurants, and restaurants that actually sell more food than alcohol can seek to have their license changed to a full-service restaurant license. And if a facility becomes licensed as a full-service restaurant, then it can open in accordance with the health directive. We also want to update specifically around social distancing, particularly in sports venues, both indoors and outdoors. The recommendation is 12-foot social distancing. We have received a lot of feedback on that, but I want to clarify why we believe 12 feet is the most appropriate number of feet for distancing. 6 feet social distancing really applies to casual contact, where people are quietly walking past each other, maybe quietly sitting near each other, not necessarily when people are yelling or singing or being loud. For those venues that have music and they're singing and also loud communication, that's actually 18 feet. So 12 feet was selected not just by the health department, but the Back to Business group, because it's really between 6 foot and 18 foot, because we know at sports venues people are more likely to yell, be loud, and that's more likely to cause transmission of disease. And then we also gave some updates to our mask directive, and specifically to point out that any child through the age of 2, so that's up to that child's 3rd birthday, really should not wear a mask. It's not safe and does pose a suffocation or choking risk, and so children below their 3rd birthday should not wear masks. While in public, any child 3 and above should wear a mask. There's been some things written previously about 12. That really had to do more with enforcement. So trying to make it as simple as possible, a child above 3 should wear a mask while in public, and that would include while they're at school. So I'm going to pause there and open it up for questions.
Laura Testino, Commercial Appeal.
Hi. I wanted to ask about school reporting. So across Shelby County school districts, You have some like Lakeland where there are as few as 2 schools in a district, all the way up to Shelby County, serving, more than 10 times as many kids, excluding those charter schools that would presumably also be lumped into reporting across that district. Is there any sort of reconsideration as to begin to identify by school instead of just by district, in order to get a better understanding of where that spread across the school district could truly be?
Not at the current time. We will focus on the community that surrounds the schools. What you have to keep in mind is that any transmission in school or anyone who tests positive in school really is a reflection of community transmission. We already provide data by municipality to each of the respective mayors. And so we'll break that information down by pediatric cases within that municipality as well. And that's an indicator of community transmission, and then also helps the elected officials know what actions to take. We will continue to look to the state health department for guidance. I know the governor has sought some reprieve from the federal government to be able to release information, and so if that changes, we will change locally. But at the current time, we really want to focus on reducing transmission, but also assuring that children aren't stigmatized and that they're able to get back into the classroom quickly and to continue to learn, which is the highest priority for children at the current time.
Laura, do you have a follow-up? April Thompson, WREG.
Yes, WREG. My question was about the education directive on the schools. Does that apply to private schools as well?
Yes.
So all schools within Shelby County?
Yes. Thank you.
Do you have a follow-up?
Yes. Can you talk a little bit just about easing parents' minds about how much information you're going to release? When you say you're going to contact those parents and that staff and those students, how much information are you going to release? Or are you just going to say there's been one case?
So actually what we do is we identify in partnership with the school individuals who may be at risk, and those individuals will receive direct notice that their child, or if it's a teacher, that teacher may have come into contact with somebody who has COVID. We typically are not going to release if that is a child or an adult, just that they have had contact and what action needs to be taken because of that particular risk. Overall, the school system can release to anyone that needs to know that they had a case within that system or more than one case. They don't actually even have to indicate if it was a child or a teacher. What I want people to recognize is that contacts are those people who have close contact within 6 feet for 10 minutes or more. And so that a school, particularly a very large school, the proportion of people who are going to actually be at risk may be very, very small. So we want to focus on those at-risk individuals first and foremost so that they can get quarantined.
Kendall Downing, WMC.
Hey everyone, I know Director Haushalter, you mentioned about close contacts, and in the school setting, is it possible if there's a child in a classroom that tests positive, is it hypothetical that if all the desks are spaced out to allow for social distancing, that no one around the child would be a close contact, or the only close contact would be a teacher? Because there may be a misconception among some parents that if a child in the classroom is positive, then everyone in the classroom is a close contact. Could you walk us through that? And then I have another follow-up.
Sure, that's a really great question, and I'm going to start with, that's why the role of the health department is so important, is that the health department actually works closely with any school, any classroom, and even any business to determine who's most at risk. And while we use some certain criteria, such as within 6 feet for 10 minutes or more, we actually look at a lot of other things. We oftentimes make site visits and see how far apart the desks are in this case, or in other places it may be a work desk. We also get information on where that individual has moved throughout the day. We also get information on whether they did wear their mask, they didn't, whether they had a cough or didn't have a cough. And all of that's used to come to a scientific approach to determining who's a contact. So with that all said, that if there is a child who is asymptomatic and had a mask on and really did not have contact with anybody within that 6-foot parameter, it's possible that initially there would not be any contacts identified. And so I think it's important for parents to keep in mind that that's really what the health department's role is to work with the school district to identify those who are most at risk. I'm already aware of other communities, not necessarily here in Shelby County, where large numbers of children were dismissed from school for extended periods of time when there was actually no risk to those children at all. So we want to balance the safety of each child, but also assure that we're balancing the need for their education and taking a scientific approach to identifying those contacts. And your follow-up, please?
Yes, it was about nursing homes. I was reading through the directive. Is the information in there about access for nursing homes and the rapid turnaround for testing, is any of that new? And has anything changed with respect to how you all are working nursing home outbreaks? Thank you.
So it doesn't change how we work with nursing homes on outbreaks. It does lend some clarity of language. And then Mayor Harris has also sent a letter to the governor requesting that under certain circumstances, individuals be able to visit with persons who are in a nursing home. And that's not explicit in the health directive, but I would just point out it's a total package of how we look at nursing homes and assure, one, that we reduce transmission in those nursing homes. Secondly, that there's transparent communication to employees and family members of those who are in those facilities, and that those who need access, whether it's a guardian ad litem or some other individual, Department of Human Services, that they actually have access to assure safety of the residents in the facility.
Tom Bailey, Daily Memphian.
Yes, good afternoon. I wanted to ask about the loosening of a social distance restriction for what might seem to be kind of an unimportant leisure service. City golf courses and apparently other golf courses across the county are now allowing 2 golfers to ride in golf carts. So they're basically side by side. The city officials say the health department approved the easing of the restrictions. And say they're kind of based on an honor system, asking the golfers a series of questions. And I just wanted to ask why the health department loosened those restrictions.
Good afternoon, and thank you for that question. It's similar to when you go to a restaurant. You may go to a restaurant with another individual, you've arrived together, you're going to sit at the table together. No one asked you a list of questions about whether or not you're from the same household. So that if 2 golfers arrive together and they were in the car together, they are assumed to be together and therefore could ride together in the cart. Ideally, they would wear a mask as well. Where you have to have an individual ride by themselves is if they actually came there by themselves. It's not like you can meet up with a group and then everyone ride together in the golf cart together. It's clearly those who came together. So applying the same principles that we do to individuals eating out together in a restaurant. Okay,
so it's sort of up to the golf course operators to kind of monitor that and enforce it, and also a little bit of an honor system as far as the answers that golfers give.
Yes, that's correct, and that's really the same everywhere. You have to make some assumptions when people come together to a restaurant that they have agreed to be there and have contact with each other. We will trust, one, that individuals are going to try to do what is right to reduce transmission, but we also are requiring that organizations do some level of enforcement themselves. The health department, as well as the city and other municipalities, do enforcement in a variety of ways, but clearly we don't have the resources to be at every golf course and at every golf cart. So we do have to rely on our partnership with golf course leaders, managers, and so on to ask those questions and exercise judgment when letting two people ride together in a golf cart.
Brad Broders, Local 24.
Thanks. Good afternoon, Dr. Haushalter. Could you give a little more specifics about you were talking about certain bars can reapply for their license. Could you give me a little more information on that?
Sure. So the state of Tennessee, which is the body that licenses restaurants, is allowing limited service restaurants that actually have more sales in food than alcohol to apply for a full restaurant license. Typically what happens is a restaurant has to bring proof of sales for a year, and then they can have their license changed from limited service to full service. But in this case, it's my understanding that the state is allowing them to bring a month's worth of receipts, and then they can open as a full service restaurant.
And as a follow-up, Dr. Haushalter, is it the health department's hope that hopefully some of these affected businesses can find a new way to reopen and sustain themselves?
Definitely. You know, we understand that there's significant impact on the economy, significant impact on our socialization as a community and so on. And so if those facilities are able to be relicensed and then open in a different way so that they can continue to thrive as businesses, we are very supportive of that.
Greg Akers, Memphis Business Journal.
Hi, Dr. Haushalter. On the Saturday report, there were 13 deaths reported, 2 of them who were new, but also 11 who were newly included since June. What are the circumstances on those 11 additional deaths?
I don't have details on all 11 of those. Keep in mind what happens is we are reporting always preliminary data, and that's based on information that's reported from the hospitals and the medical examiner's office. But then the death certificates actually get reviewed at the state level by the state medical examiner, and then there may be adjustments to the data. And there are several things that can happen. There might be a decision that COVID really wasn't a contributing factor or cause of death, and so that person may be removed from the number. Or when there's been a review, there may be a determination that, in fact, COVID did play a significant role in the person's death, or that it's probable. So an example, and this is occurring nationwide, we do know in many nursing homes nationwide, individuals were not getting tested. But if there was significant outbreaks in a nursing home and someone died of pneumonia, it's fairly likely they were infected with COVID. And so that might change the death certificate. And so it's a layered process, but it assures that our numbers in Tennessee are as accurate as they can be because multiple people are looking at those. So again, I don't have specifics on all 11, but it was because there was additional review at the state level.
Thank you.
Mark Giannotto, Commercial Appeal.
Hi, Dr. Haushalter. I wanted to follow up real quick on what you were talking about with the sporting venues in your initial statement. When you look around the country, either a lot of jurisdictions are either not allowing fans or they've gone by 25% capacity, which is about the 6-foot social distance. I'm curious with the 12-foot social distance here, because it is different than it seems certainly everywhere else around the region, but and I think even maybe in the country. What was the, I guess, research and science that you guys relied on to come up with that number? Or was it, as you initially said, just kind of because of it was between the 6 and 18 that you had with regular stuff and music venues?
So what we do know is 6 feet is not sufficient. And there was definitely a goal, not just again with the health department, but with members of the Back to Business group to assure that sports venues could open and have fans. So we could have issued a directive to not allow fans. So that was sort of our beginning conversation. Is it safe to have fans or not? Particularly given in July, which when many of these were being reviewed, our cases were going up exponentially. So we committed that we wanted to try to work with the industry and different venues to come to a safe place to allow for fans to be able to be there and participate, but reduce the likelihood of transmission. 6 foot really is used for very casual contact, and I want to continue to reinforce that. 6 foot is for casual contact. It's not when people are yelling. It's not when people are in very close contact yelling. It's also not when people are actively or potentially actively engaged in drinking alcohol. So then we originally began to look at indoors versus outdoors, and then came to the place that really 12 feet was a fair number. We actually went between 10 feet and 12 feet, and that we also were looking at the capacity piece, and that could get to limited capacity and around 12 feet. We also initially said that indoors it needed to be much further, which is 18 feet. Very consistent with music venues. That's what we said initially for indoors, but have reduced that back to 12. We will continue to look at it, and that's why data is so important locally, is that as these venues are opening, we can begin to gather data to see if we are having transmission in those facilities or not, and go from there. The other thing that we looked at is what's called zoning and cohorting, so that in some places you can keep groups to a small area. But to do that scientifically, you actually have to have a lot of knowledge about the way the air conditioning units work indoors and how their other airflow works. And there just wasn't sufficient information to go with a zoning approach. And so we agreed collectively that based on the data we had, 12 feet was a fair distance and still allowed for facilities to open.
We are out of time. Are there any closing messages?
I just want to remind people that it's really important that we stay the course. We've said this before. We know that people are getting fatigued in some ways regarding COVID, but it's really critical as kids are back in school, as sports venues open, as contact sports are underway, that we give a few weeks to see the impact of that on our cases, and that we continue to mask. We are really pushing heavily the need to continue to mask, and that we continue to make good decisions about social distancing, and ideally our numbers will continue to come down. Thank you.
Thanks, everyone. We'll see you Thursday.